Hello, everyone. Thank you for tuning in today. Welcome to It's Time for More Injury Funding, the podcast for all who want to learn about legal funding and its significance in the personal injury, tracking law, workers' compensation, medical malpractice, dog bites, and many other types of law practice domains. I'm your host, Laura, founder and CEO of More Injury Funding, the legal funding counselors with passion for law, medicine, legal funding, and heart for all suffering individuals. More Injury Funding is a sponsor, member, associate, board member, or business partner of this podcast. Georgia Trial Lawyers Association, Academy of Truck Accident Attorneys, Sandy Springs Bar Association, Georgia Association for Women Lawyers, GOLD for short, Georgia Association of Paralegals, Atlanta Legal Aid Society, State Bar of Georgia, St. Andrew Rowing Club, Georgia Hispanic Chamber of Commerce, and Georgia Council of Chiropractic. In today's episode, I have a special guest, Dr. Jeremy Cassius, founder and CEO of Mental Pain and Trauma Centers based in Texas and treating patients in many states now, including New Hampshire, Massachusetts, Connecticut, Rhode Island, Maryland, Vermont, New Jersey, Delaware, District of Columbia, Georgia, Alabama, and a few others. With a wealth of experience in diagnosing and treating post-traumatic stress disorder, anxiety, and depression, Dr. Cassius is a leading expert in the field. In this episode, we will get to learn more about his journey and insights. And at the end of this episode, I prepared a fun pop question for our guests, so stay tuned. Welcome to Time for More Injury Funding Podcast, Dr. Cassius.
Thank you for having me, Laura.
Absolutely. So to start off, can you tell us how you got started in the personal injury mental health business? What inspired you to start your own center?
Well, I guess that would be a long story that goes through my career. I grew up with a family that had a psychologist for 30. My father was a psychologist for 30 years in Memphis, Tennessee. And I went to conferences with him as a child. I was kind of in the mental health field, whether I liked it or not in the beginning. And I'd always say, Dad, who are these weird people? And
I love it.
we would always talk about the people that were at the conferences and that kind of thing. And later on, I got my degree in counseling, and I started working in the mental health field in about 2000, the year 2000. And I worked at some treatment centers for adolescents. I also worked in private practices. And over time, I just gained a lot of experience working with people. And then around 2009, I think, or so, I was started doing forensic evaluations for immigration law, for family law, and for criminal law. And while I was doing that in private practice, I met a personal injury attorney who told me about his business, which was, on a lien and settlement type business. And he said, we need somebody to help us with our trauma clients. And I said, how does that work? And he said, well, you're not going to get paid for a couple of years until the settlement comes in. I said, I'm not really interested in not getting paid. Laura, I don't know how many people would be.
No,
So
not too many.
told him that's probably not gonna work out for me. And this was already about 2014, where I took my first personal injury case from him. I told him I'd give it a try, and it was a 19-year-old lady who drove a car under a truck, and she hurt her shoulders, hurt her neck, and more so, she had emotional injuries, which were even bigger scars for her than what she had with her shoulder and neck, because it was pain that lasted a lot longer in her life than the pain in her shoulder and neck, which was treated by, physical therapy and chiropractor, and she felt like it had gotten better. But the emotional injuries that she was suffering were much worse. She lost her job. She dropped out of school. She lost her boyfriend. She was having trouble with her family at home. And we worked together for about 6 months, I would say, that first client. And after we were finished, I'd go to the law office, probably every month saying, hey, where's my check? And it's not here yet. So after a couple of years, I was able to get part of the settlement. I'm like, maybe this would be a good adjunct to some of the other stuff I'm doing with forensic evaluation. I can use that forensic evaluation business to subsidize the work I'd like to do in personal injury, because I enjoyed the work I did with that first client. And over time, we just started expanding that program. And about around 2020, before COVID, I hired a marketing professional who helped me educate attorneys as to what I was doing, because in the personal injury field, traditionally, it's, hey, you got hit by a car or a truck, you better go get your bones fixed. You know, you got to go get the MRI. You got to go to the chiropractor. You got to treat the pain that you're suffering from. But mental health has never seen a huge place in the personal injury industry amongst the attorneys. But it's like I said before, the duration of the symptoms, they could last a long time after the trauma. If it's not treated, is going to continue to recycle itself. So we began doing that more, and we began educating the attorneys, and they would say to us, mental health, I haven't really heard of sending people to mental health doctors before, or psychologists or counselors or whatever. We haven't really done that before. And I'd say, well, you probably have a mental anguish claim, right, on an accident where somebody's suffering a lot of anxiety. And they said, that's true. We need some evidence to back that up. So that's where we come in. And we started doing psychological evaluations and therapy for these clients and treating, PTSD, anxiety disorders, you name it, depression. We would treat the clients and help them, and we would do it all without the client having to pay out of pocket for the expense up front. And this was attractive to me because I'm a helper. I got into the field of psychology, yes, I grew up in the field, like I said, but it's always been part of me to help other people. And I saw this as an opportunity to provide help for people that might not ever go to a therapist. And I believe most of us need a therapist, need somebody to talk to about what's on our mind.
100%.
And this was something that was, I think really a good thing for me professionally, because I wanted to help people, get therapy. And this is a way that people could get in the door without having to, pay or deal with health insurance and that kind of thing up front. And it's been really helpful for a lot of people. We see about 170 clients a month now at the Mental Pain and Trauma Center. So we went from that first client to where we're now at about 170 a month. And we're really giving a lot of good treatment to people who, would like to get back into the swing of things after, being taken off track by whatever injury they were suffering from. And I'm very proud of what we've done here. I think it's been great. And I only hope that more lawyers can learn about it over time, because it's such a benefit for not only the client themselves, but for the legal matter to be able to go to an insurance company and tell them, look, this person's really suffering emotionally, and there's not much we can do with an MRI that's going to help them with that, or a chiropractor that's going to help them with that. We need a psychologist to help them. And they're going to need this over the next so many years to work on this trauma that they have.
That's truly commendable. How have you seen your services benefit attorneys who work with personal injury cases?
Well, we do a comprehensive psychological assessment in the beginning of the case with the client to really understand, all the nuances for that particular client. Everybody's affected differently by trauma. So you really have to narrow down and pinpoint, what exactly the sources of that trauma are. And sometimes, yes, they come with a previous trauma, and we have to be able to understand how this current trauma that they're in from whatever injury they're dealing with has made that original trauma worse, exacerbated that, because all the research shows that somebody who comes in with a mental health condition, and even if it's a treated condition that they've learned to cope with over time, once they have a new event that comes in there, the trauma from the next event is much worse than the first time. It's not like they've learned to cope and now they're better. It gets exacerbated, and at least for post-traumatic stress disorder, it really is not a good thing if somebody goes through more traumas after the original trauma, because that trauma is always recycling until it's really treated and worked on. So when they have a current trauma, that's obviously our main focus, right? But we want to know who the whole person is and what they've been through in their life to understand, how are they going to deal and cope with this trauma? What is going to be their prognosis for recovery, and how long is it going to take them to recover? And how are we going to help them recover? We use therapies like EMDR, eye movement desensitization reprocessing, because it helps them work with the right and left brain together to reprocess the trauma that they were dealing with. So, the whole idea of that is that when somebody goes through a trauma, it's such a shock to their system that their brain is not working. It's like if you stop the washing machine in the middle of the cycle, it'll just stop and won't be cycling anymore. Well, the brain goes through a process too, that it has to go through a certain cycle itself through it. Anything that you're taking into the brain through your frontal lobe, it has to go through a normal human type of cycle to be able to be processed. So when a trauma happens, that whole process is interrupted, and the right and left brain, which are usually working together to decipher how to deal with situations, is not working together. So that's the shock, the traumatic shock that we all deal with if we face trauma. So with EMDR, at least, we go back through that trauma, we reprocess it with them in a safe environment where they're able to use the right and left brain together to help that cycle.
That's just fascinating. This is just fascinating. And your contribution to legal field is so valuable. Can you tell us a bit about your career before starting the Mental Pain and Trauma Center? You had mentioned that your dad was a psychologist, and that you followed him around for many, many years. But tell us a little bit about yourself.
Okay, well, just about myself in general, I'm married with 4 children. They're great. I'm always busy with them, never a dull moment. And, I started working in the mental health field in really like late 1990s, early 2000, and worked with adolescents in a residential treatment center, worked in many private practices. Also have been served as the director of an organization, a mental health agency called Plan, where we help people with severe mental illnesses like bipolar disorder and schizophrenia. And we helped their families who were concerned about what was going to happen to their adult children when they passed on. So that was a wonderful experience for me, and it helped me learn a lot about just a lot of different aspects of severe mental illness. And it was a great learning experience. We provided therapy, we provided group programming and groups for them, and we also tried to help them with a kind of a game plan for what they're going to do the rest of their lives. We started a work therapy program where they would go out in Dallas to different agencies and work at those places. And that was in conjunction with the Dallas Center for Rehabilitation. And one of the things I learned at Plan was about cognitive remediation therapy, which we used for people with schizophrenia and bipolar disorder and other mental illnesses. The idea being that it would help them rehabilitate the parts of their brain that were affected by their mental illness. And we had a part of the program was computer puzzles, and kind of like lumosity.com, like you'd say, but
very familiar with that one.
Mm-hmm. Yeah. And an hour of therapy a week and a group therapy situation every week for these clients. And it was a wonderful experience. Really helped them kind of understand their illness better, but also understand how their brain can get better because of neuroplasticity that we all know with the brain. And we worked on reaction time, processing speed, attention, memory, executive functioning, which are all parts of, somebody who's affected with a mental illness. Those kind of are in decline most of the time. So those are factors and issues that they needed to work on with their brain. And I see the correlation with traumatic brain injury with a lot of those clients. And, I think there's definitely research that can be done to show there's a lot of similarities with needing to work on executive functioning and attention and processing speed and memory. These are things that we are trying to do at Mental Pain and Trauma Center right now. We're working with some research psychologists to set up a program for neurocognitive rehab. We have a professor that we're working with from Fairfax, Cornell, and Columbia University. So there's 3 professors that we're working with right now and developing a really awesome program, which should be a game changer in the personal injury industry, especially for those clients that are victims of a traumatic brain event. So we're real excited about that. And I believe that my background, with just helping people in trauma and situations and the diversity of what I've experienced has really led me to get to where I am right now with the Mental Pain and Trauma Centers.
I can't wait for your collaborative work with those professors to come out soon.
Yes, it's going to be great.
Dr. Cassius, you had such a diverse career. Are there any personal traumas or experiences that have inspired you in your life and your work?
Yes. I've had to deal with a lot of trauma in my own life, and I feel like that has helped me um, with my own situations have certainly helped me professionally as well. And I think all of us grow based on things that have happened to us personally and experiences we've been through. I've been the victim of 2 house fires. I could probably write a book. Like, just doesn't
Mm,
happen to that many people who've been through 2 house fires.
mm.
I was as a teenager in Memphis. I got held up at gunpoint.
Oh, goodness.
Um, I've lost 2 parents to sudden deaths.
Mm,
So I've dealt with some situations in my own life where I've also had to go to my own therapy, and I encourage everybody who goes through trauma or situations to go talk to somebody, a professional about it. And those experiences have really led me to where I am today with the mental pain and trauma centers. I appreciate how I've been helped to work through and cope with some of the trauma in my life, and I believe that we can help many others that are suffering from trauma, which is not always so easy to, you know, be aware of. Even sometimes we're not aware of the trauma that has kind of motivated us to be who we are, and it's important to kind of embrace that trauma and to learn to cope with it so we can be the best version of ourselves that we can be. And I believe that there's a lot of clients that we see on a regular basis that they try to avoid even talking about their trauma because just talking about it stirs up so much emotion within them that they don't even want to address it. And the problem is when you don't address it, it's just going to come back in some other shape or form to haunt you. So it's important to address these traumatic situations that we go through in our own lives so that we can eliminate some of the barriers to being the best version of ourselves that we can be.
mm. Thank you so much for sharing this story with us. Um, on a lighter note, do you have any hobbies or interests outside of your work? I know your work is busy now with your, especially growing, exponentially growing practice.
Right. Yeah. So I love sports. I love to play basketball. I love to play tennis. I used to like to play other sports until I got a little older. So
I feel you
I like
there. I feel you.
I like the outdoors. I like to go hiking. I like to go biking. I'm really big on the Peloton now, and I highly encourage the Peloton for anybody that likes to get moving when they don't have a chance to really get out of the house much. It's
Hmm. Hmm.
fantastic.
I don't know
So
if you know trucking trial attorney nationwide known Joe Freed. He's the one who actually
sure.
inspired me to do Peloton.
Oh yeah, really,
He's
it's
he's
amazing. Yeah,
he's been doing this he told me every day for so many years. It's just amazing. And he stays in
yeah.
shape and it just gets you going. He says, no matter what, no matter how tired I am, whatever I am, I find a way to do it.
Right. What I like about the Peloton is it gets you to sweat. Sometimes you're walking on the treadmill, you're not really sweating, but the Peloton kind of forces you to compete with yourself, which is
Mhm.
because you're trying to beat your last score or whatever it is. But you can do that. But if you want a lighter ride and you don't want to beat yourself because it was a hard day or whatever, and you want to go a little lighter, you can do that too. Nobody's gonna fault you.
Mm-hmm. And it sounds like
So,
you said, makes you sweat. That sweat makes us feel alive. And
right,
that's an amazing feeling.
right.
Can you, doctor, explain the role of you as a forensic psychologist in assessing and treating PTSD, anxiety, depression, or any other emotional distress in your personal injury patients?
Yeah, sure. So the role of a forensic psychologist is really to examine clients based on collateral information, which is information from you know uh, doctors, witnesses that saw things happen, or psychological testing is considered collateral information, and to kind of envelop that and all into a comprehensive evaluation and write a report on it. Um, so the forensic part is more of the well, I'll say it's not as much a part of the treatment as it is part of planning the treatment based on everything that we know about somebody. And it's very important that we're objective and that we really come to good diagnostic conclusions because you might be called to testify, and we want to make sure that we're testifying over facts. So scientific facts backed by scientific evidence. So that's the forensic aspect of it. The treatment part of it's totally separate arm of what we do is treatment for anxiety, depression, and post-traumatic stress disorder. And that is more of, we're with a client, we're working with the client, and we're helping them with the goals that were set up by the treatment planning that was done. So we're working on those goals. We're trying to help them get to a point where they feel stable enough to, let's say, just use an example, get back in a car again. Some people don't want to ever get in a car again when they get in a car wreck because of the shock that they went through. I know my first wreck, I was 16 years old. It felt like a tank hit my rear end of my car. And it was like, something you never forget. And you kind of look over your shoulder for a long time thinking, become the positive, I guess, of that is you become pretty defensive, cautious driver. But the negative of it is some people don't even want to get into the car again. So one of the things we're doing here at Mental Pain and Trauma Centers for Therapy is something called automobile exposure therapy. Exposure therapy is the best type of therapy you can do for anxieties. And what we're doing is we're putting people in a car. We're doing a virtual simulation with them. And we use the Meta goggles, to do some virtual, scenarios that people might find themselves in. And it's been a game changer as far as the therapy goes for, what we're doing with these clients.
So now let's shift our focus from your childhood and family hobbies, even though I love talking about this. We could spend hours and hours getting to know each other here, to your personal injury patients. What are some common symptoms of PTSD, anxiety, depression, emotional distress, sleep disturbances, or any other mental health conditions that you see in your personal injury patients? And how do you approach diagnosing and addressing these issues?
Right. So they have to meet a few characteristics to be considered something of post-traumatic stress disorder, and they're all related to the event that occurred. It has to be something that was like a life-threatening experience. It's something that causes probably flashbacks of some sort, which we call a dissociative experience. There's some irritability and anger, kind of emotional disturbance issues where people might, go from very irritable to even very depressed at times with post-traumatic stress disorder. And so we see a lot of those symptoms. Not all of our clients have PTSD, though. Some of them have more of an adjustment disorder where the stress that they faced was a great stress and it was traumatic for them, but they haven't really, it's not a post-traumatic situation where it keeps cycling back, but it's more of like, it was so stressful for me and my life has changed and they've had to adjust to the new version of themselves, which is affected by a lot of different anxieties. And so we see a lot of, people that aren't able to sleep the same way anymore, not able to eat the same way anymore. They're not able to play with their kids like they used to. They're not able to, if they're a grandparent, they can't play with their grandkids the way or pick them up the way they used to. They don't want to get in car anymore. These are a lot of common symptoms that we see. People that have been assaulted that are always kind of afraid to go out by themselves ever again, and at night especially, and they're always looking over their shoulder to see if somebody's coming. So we have a number of different kinds of experiences that people were injured by, so we work with people with like I was just saying, there's sexual assault victims we see physical assault victims. We see slip and fall clients. We see people that have been bitten by a dog.
Dog bite injuries.
Texas, it seems like it's going on everywhere. I don't know if it's
Oh
happening like
God,
that in Georgia, but
too many.
yeah, too
Since
many
I work
dog
in personal
bites.
injury field, I hear several cases every
Yeah, if I
day.
see a dog off a leash, I'm going the other way. That's all I can tell you. It's based on some of the stories I've heard. It's just hearing these stories, gets us to be more conscious about some of the stuff that's going on as well.
Very,
I
very
know
conscious and very aware.
my
Yes.
wife works in my office too, and just always talking to her about, let's be really careful on the interstate. Like we gotta drive more carefully.
Let's put the helmet on whenever we
Yeah.
go.
So we've seen the gamut of a lot of different issues from severe to mild, from mild to severe, or however you want to call it, and people are impacted all in a unique way, and we have to be sensitive to that when we're working with them as well.
Absolutely. How do you differentiate between natural reactions to traumatic events and more serious mental health disorders like anxiety, depression, in personal injury, or workers' compensation cases, or any other case, really?
So again, if people have been through a traumatic event, they can, you know, some of them meet a criteria for a more severe mental health diagnosis based on kind of what they're presenting with. They have to meet sort of different criteria based on our diagnostic manual, um, and then others don't necessarily meet the same criteria, but they're still benefiting from our services, and they usually have some diagnosis, but not as a severe of a diagnosis. And we again, we diagnose so we know how to treat and what to treat. I mean, that's the main reason we ever have a diagnosis, is so we know what the game plan is going to be to help this person. So we've again we've seen like post-traumatic stress disorder, anxiety disorders, depression, and sometimes the depression and anxiety are also part of post-traumatic stress disorder. So the differentiation is just kind of, once we're working with the client, if they're showing those characteristics of, you know, flashbacks, nightmares, um, the anger and irritability, the depression, the almost dying kind of experience, or feeling like they were in a life-threatening experience, that's more of the post-traumatic stress disorder side of things. And then if they're mainly just kind of sad and never happy and isolating themselves, not going out with friends anymore, and not spending time with family anymore, and just kind of isolating themselves, it's a depression type of issue more. Sometimes they go together and sometimes they don't. I don't
Interesting.
know did that answer your question?
Yes, yes, that's
Okay,
of
good.
course. I have many, many more questions, but let's move on here. We'll have to come up with a new episode to cover more of this. It's just
Right.
really fascinating to me, and I'm sure my
Thank you.
viewers and listeners too. Talking about treatment, what treatment approaches or interventions you have found to be successful in helping personal injury patients manage their anxiety, depression, and other mental health issues?
Okay, so like I was mentioning somewhat before, the EMDR, the eye movement desensitization reprocessing, it's good for some clients. Some clients, they're just like, this is weird. But for some clients, it's really good. Other clients like more of mainly just kind of talk therapy and getting some feelings off their chest, and helping the having the therapist help them, with kind of understanding, how their feelings are fitting into their daily life and functioning. And then there's, exposure therapy, like I was telling you about before, where we try to expose them as much as we can to whatever they're avoiding now because of what happened to them, so
Mhm.
they can confront the anxiety and become more comfortable with it. A classic exposure therapy is, someone, for some reason, I don't know if they're working in a campsite or something, but they have to address their fear of snakes. I mean, most people just don't want to get near snakes.
No,
Let's say
no snakes,
somebody
no snakes, please.
let's just say for some reason somebody wants to address their fear of a snake or snakes. Classic exposure therapy is, you touch the snake a little bit now, and then you touch it more the next time, and then you touch it more. It's kind of baby steps into, just now. First would be maybe you look at the snake, and over time, that person who is going to be in an occupation, let's say, that works with snakes, will feel better about dealing with a snake than he did before he started. Let's
So
say that's
killing your
that's
fear
that's
is equal.
classic exposure therapy. Like, you a little bit at a time, and we try to do that with people that have been in injuries too. Let's say somebody got injured, playing basketball. Okay, I'm just using that as an example. It's not something we would see because it's usually not a fault kind of thing. But let's say that happened, and he never wanted to go back to the gym again. Well, you take him a little bit to the you take him to go look at the arena or the gym. Then you take him to go sit on the sidelines. Then you take him to go stand on the floor. And then you take him to go actually run with some guys. And then you say, okay, now you can play a game. So it takes time to kind of get back into the swing of things. But, we have to remove all the barriers one step at a time. That's exposure therapy.
Very
We do that with
interesting.
cars.
Hmm.
And we have most of our work is virtual, but
Hmm.
in our office in Dallas, we have a vehicle, um, like a a video game type of vehicle, not a real car that we pulled into the office. We need like a whole separate office for that.
Mm-hmm.
But so we do that in the office, but also virtually. We have a way to do it also with people can go get in their own car. We have play therapy also that we do with children, where we do virtual play therapy. All of our therapists have been trained in that. I should tell you a little bit more about our program. We have about 15 PhDs around the country
Oh, wow.
that do psychological evaluation. They're all amazingly qualified. And we have 30 trauma therapists. So we can either provide live service or virtual service. To the national clients, we're mainly doing virtual service. Even for most of Texas, we do virtual services because most people, like that better. That's why, COVID helped us,
Get there,
get more,
make it easier.
make it easier, get more out
Mm-hmm.
there with the virtual experience that people can have with a therapist now.
Mm-hmm.
And, so most people have been through injury situations are going to many different doctors, right? Or they're going to physical therapy, and they're always getting out of their house, having to do these things. And sometimes they don't want to leave their house, I should say also that we work with clients that have been through wrongful death also. And we're like the only provider that can really help those people, because most of the time when there's a wrongful death situation, the person is dead. So they're not going to anybody. Right. So their survivors though need some help, and they need to talk to somebody about what's happened. And we do grief therapy for them too. So
Very,
just
very
wanted
interesting.
to let you know about that.
Absolutely.
Also.
And so you mentioned children. Just kind of briefly, what group is easier to work with, or not, I wouldn't say easier, but maybe faster? What's the like speed wise as far as therapy, children or adults?
That's hard to say and answer for that, because everybody's so different. Even, children are affected by trauma, but they're more resilient. Okay. We found that with most of the children we work with. However, they sometimes, after, like, let's say they were in a car accident, they'll get in bed with their parents, and every night they're going to their mommy and daddy because they're to get into bed because they're scared about what's going on, at night a lot. And that may happen more after they've been in a traumatic situation, or they'll be crying a lot at night or something. And they're not really communicating those things because, children communicate through play.
Mm-hmm.
They're not always going to tell mommy and daddy what's going on. They might say, I'm scared of the boogeyman. But to really kind of get on the depth of what's going on with that, we found with children that it's best to do play therapy. They get their favorite toy out, in virtual, they put a blanket down, get their favorite toy out, they start playing with it. Then they start talking a little bit more while they're playing, because this is their style of communication.
Mm-hmm.
So, and that's how they learn about the world as well. So it's really important to be able to have the experts in play therapy working with them. And we have outstanding play therapy staff here. So I'm really proud of that.
Great to know.
Yeah.
Great to know. Can you, Dr. Cassius, discuss the long-term effects of untreated anxiety, depression, or any other mental issues in personal injury patients, and the importance of early intervention and support?
Wow, that's a loaded question.
Loaded it is.
So it's important to get the clients in as early as they can come in. However, that doesn't mean if they come in 6 months later that we can't help them. Yes, it's important as soon as they can get in, because then you don't have to explain a gap in treatment. Like, why'd you wait 6 months to get treatment? Because sometimes people aren't experiencing or realizing that they've been traumatized until 6 months after an injury. Right away they're dealing with the physical pains they're having to deal with. Well, once that physical pain is removed, then they're like, this is kind of scary for me. I don't want to, drive a car right now, or whatever it is. So the emotions sometimes don't settle in for a little while. So that's why somebody would come later. But if they come earlier, we could prevent some of that from happening. And there's lots of evidence to show the connection between emotional injuries and physical injuries, meaning that pain is increased Well, anxiety is increased. When you're going to get a shot at the doctor, when you're not looking and you're not scared of the shot, it doesn't hurt quite as bad. But when you're looking and you're scared of the needle, it's like, oh my gosh, you're sensitive to the pain a little bit more.
Mm-hmm.
And that's the idea with trying to get people in as soon as possible, because it's going to help their pain.
Very
There's
interesting.
tons of research about this, Laura,
Mm-hmm.
also,
Mm-hmm.
where if you remove anxiety from somebody, it's like their pain tolerance is much greater. They can
Mm-hmm.
handle a lot more, because they're not tensing up and they're not scared. And half the time when people are in a car accident, I shouldn't say half the time,
Mm-hmm.
half the time maybe for some of the clients we've seen is, part of their injury is just the muscle tension that they're dealing with, because when they got hit by the car, they tensed up, and their back wasn't really hurt by any collision. The back was hurt because they got so tense. So when we can remove that tension and decrease the anxiety about what's going on with them, the road to recovery is a lot faster.
Mm-hmm. And I'm sure you work with so many different other medical specialties. And so how do you collaborate with these medical professionals, attorneys, and to support other supportive services to ensure comprehensive care for your personal injury patients with mental health conditions that personal
Right.
injury may have caused?
So in our office, we have many staff people that understand the legal system and what's going on with the clients in the personal injury industry. And we are always talking to the law offices, letting them know, hey, your client's been to this many sessions already, just so you know. We want to keep you updated so you're in front of everything, so you won't run into any kind of limit issues or anything like that. But also we want to let you know where your client's at in our process. They finished their evaluation, they're getting therapy. We are in constant communication with the law offices, number one, because we want to make the lives of the law firms easier, so to speak.
Mm-hmm.
Not just the clients, but the professionals that we're working with. As far as the medical doctors, we often get records from them so we can review the records and kind of understand what the client's dealing with, and be able to treat the client in a more comprehensive way. So we're also in communication with them on a regular basis. Just recently, we have somebody in-house that we're able to prescribe medicine now, which is not pain medication, but we're going to prescribe like psychotropic medication.
Mm-hmm.
So for people that are dealing with anxieties, we can help them with medication as well, or long-term depressive kind of issues. We can help them with that too.
That's great. Do
That's a
you?
new program we have.
Mm-hmm. Mm-hmm. And do you, Dr. Cassius, use any specific techniques to educate your personal injury patients about mental health issues and about reducing stigma and promoting self-care and coping strategies in their recovery process long term?
Our therapist, that's part of the therapy they do with the clients, is just educational aspects of it, helping them with their care long term, because when they're released because of the legal matter, we help them go to places where they can get help they need. We utilize the resources we have in the community or the communities they might be in, and we try to send them to places where they're going to be more integrated into their life than they were before, possibly.
Mm-hmm. Could you share an example of a case or a couple examples maybe where your intervention and treatment plan had a positive impact on a personal injury patient's specific mental condition, be it anxiety, depression, or anything else?
Okay, sure. So we had a client a few years ago who ran himself over he was training at a warehouse, and he fell out of the forklift,
Ooh.
and it went over his foot and crushed his foot.
Uh,
So his foot was like completely deformed after that. And it wasn't his, it was the training that he was going, it was the fault of that happened, because he wasn't doing it the way he was supposed to do it, because he wasn't trained right to do it. They were training him at that time. And he came to about 30 sessions with us working on the trauma that he had of just trying to, he was like a 20-year-old man, and he was trying to date and meet people and that kind of thing. And he felt like he could barely, go outside because he limped, and he didn't feel that he didn't feel like he could engage in the same activities he was in before. And it looked funny. His foot was deformed, and we were able to see him for about 30 sessions and really get him to a place where, he was very grateful for the help we gave him. And he felt like, this was the new him that he has to be accustomed to and show the world. And he was empowered by what we did with him. So that's one case example. I've got many others. Just, we had dog bite cases where, a similar situation that there was a child who had his scalp taken off by a dog, a 12-year-old. Again, he was somebody who was very involved playing sports for his school. And then after the situation, he could barely, show his face, and he wore a hat everywhere he went. He was the life of a party before this happened to him. And then he had a really hard time socializing, especially at that age, going through puberty and talking to women was very difficult for him. Had wrongful death cases where, a daughter never saw her father again after going out to get the groceries on his motorcycle, and she got a phone call that your father got killed in a car accident or a motorcycle accident. And just the suddenness and the change that people have to go through for some of these situations, it's life changing.
Thanks for sharing these
feel like
cases.
it's very important for them to talk to somebody who can help them adjust to the changes that they have to go through based on the way they appear now, or based on their new life that changed in a second.
Thank you for that. What advice would you give to individuals who may be experiencing post-traumatic stress disorder, anxiety, depression, sleep disturbances, or any other mental health issues following a personal injury? And how do they seek help and support?
So I would say my advice would be to talk to somebody, about what you're going through, or even what you're not going through. Sometimes, like I said before, people are in denial often about some of the emotions that they have related to a trauma, because they don't want to face those emotions at all because it's too hurtful for them to do. So I would say talk to somebody, whether it's a professional or not. In some cases, maybe they're not a professional, maybe they're a friend or a parent. But best to talk to a professional who knows how to deal with the issues, but talk to somebody. And I would say, if you want to find us, you can refer clients to referrals at mentalpainandtrauma.com. My email is Dr. Cassius at mentalpainandtrauma.com. You can certainly email me anytime you want with questions. And, tell your law office what you're going through as well, because sometimes the lawyers, they're not trained to be mental health professionals. Even the paralegals and case managers. So really try to get an overall view of what the client that you're seeing is going through, outside of just the pain issues and the broken bones, but how are they dealing with life now? Get the overall view. And if you hear things like, "Oh, well, I'm not sleeping well, I'm having nightmares, I'm not able to work anymore, and I'm sad about it. I'd like to do things I used to do, but I can't anymore." If you're hearing these things, these are symptomatic, normal symptoms for somebody with an injury to go through, but they need help. And
Mhm.
they you can send them to mental pain and trauma centers, and we'd be glad to take care of them.
This is so great. I hope this episode about mental health psychology in personal injury law was so interesting and truly informative and educational. And as promised, here's a fun pop-up question for you, Dr. Cassius. You ready?
Sure.
Okay.
I think I'm ready.
Okay. Well, let's try and see.
Okay.
What's your favorite childhood memory? And you can only list one.
Oh wow, that's a tough one. Um, my favorite childhood memory is going with my dad to a football game that I went to. I'm asked about them. I don't know. I liked being with my dad a lot, and I was the youngest of four kids, and you know, he was a big part of my life, and just to be able to go anywhere with my dad was like a special thing for me. So
Mhm.
that
Yeah.
stands out for me when you ask me that question. A favorite childhood memory.
Mm.
Of course, if I'd had a little bit of time to prepare it, maybe I would have thought of something a little bit different. But
That's
that's my favorite
beautiful.
memory is really of my father. Yeah.
I love it. Actually, talking about dad, I have the same feeling. My dad lives overseas and just getting old, and he had actually a traumatic brain injury, which we can talk about
Mm,
next time offline. But that changed his personality. So he was one of the funniest people I've ever known, probably the funniest man I've ever met in my life so far.
right.
He's just walking joker, really. I mean, he would just make up
Yeah.
these jokes on the spot as he went, and no joke would be ever repeated. It was just like new, always fresh and new.
Right.
And yeah, with traumatic brain injury, he's slower, but I'm so happy he's still alive. And I talked to him, and he talks, with kind of blurry speech and much slower. But yeah, so I probably would answer the same question, just like you
Right.
did. The best memory spends was spending time with my dad when I was little.
Right.
Again, Dr. Cassius, thank you so much for spending time with me today. It was so interesting, and I have a million other questions. Hopefully, we can spend another episode together,
That'd be great,
time,
Laura. Thank you.
time permitting. And if you don't mind, just kind of recap your website and phone number and email once again, if you don't mind.
Okay, so our website is www.mentalpainandtrauma, all spelled out, .com. And you can email us at referrals@mentalpainandtrauma.com or Dr. Cassius at mentalpainandtrauma.com. And you can always reach us at 214-984-8165. And we also have 1-844-PI eval.
That was Dr. Jeremy Cassius, founder and CEO of Mental Pain and Trauma Centers based in Texas and treating patients nationwide. I want to thank you all for listening and watching our story today. For more tips and tricks on legal funding and personal injury law and medicine related topics, follow me, download and subscribe and like. Of course, it's time for more injury funding podcasts on several podcast platforms, including but not limited to Spotify, Amazon Music, Apple Podcasts, iHeart, and all others worldwide. And follow more injury funding on LinkedIn, Instagram, Facebook, Twitter, TikTok, Pinterest, YouTube, Google Business Profile, and my website at moreinjuryfunding.com. That's with 2 O's. I can't wait to see you, my dear listeners and viewers, at my next upcoming episode. Until then, be well. Thank you.
Thanks, Laura.